So how long after your shooting did you actually seek help?
Yeah, I think it was a little over a year and a half.
So when did you start? What were the subtle signs that maybe you started seeing that you ignored or tried to tell yourself that you were fine?
Yeah, I mean, you get the checklist of post-traumatic stress, and they were all there, right? It was just a matter of, was I ignoring them or paying attention to them? But there was the hypervigilance type stuff. For me, I really just became obsessed with training, and I found myself, I was going to the pistol range every week, right? And I had to go to as many tactical schools as I could possibly go to. I became a bit of a workaholic. And then I started getting headaches, and then I started just having emotional breakdowns just at random times. In particular, I later discovered that this is kind of tied to the way the shooting occurred, but I would have just this total emotional breakdown as I was driving out of the back lot of the PD. Only when I was alone, never when anybody was around, and only for these like strange small spurts, right? And I had no idea what was going on.
Did you have anybody in your ear early on saying, "Hey, get yourself some help," or anybody? I don't want to call it a mentor, but somebody who was trying to guide you towards it at all?
I really didn't. I think that's something that's needed. I think there should be a lot more discussion about it. And my advice to anybody who's involved in a critical incident is just go start talking to somebody, because even if you think that you're totally fine, I thought I was totally fine, right? Even if you think you're totally fine, what happens is you start to get these thoughts that are kind of nagging about, oh, I should have done this or I could have done that. And those are the things that start to build. It's the woulda, coulda, shouldas about that particular critical incident that build in your mind. And then you start to kind of fill in these gaps and build this narrative about how you screwed up. And that's the reason it happened. And that's, you should have done better during the incident, or, you can convince yourself all kinds of things based on whatever story you tell yourself.
But you were not physically injured during that incident?
Correct, yeah.
And so when you finally went to get help, what was the final straw? What made you kind of say, hey, was it something where you actually acknowledged, like, I'm ignoring this, or was it just a catalyst, a significant event that said, I need to go get help?
Well, my marriage just completely started falling apart. I had become a complete workaholic. I was working as much overtime as I possibly could. When I wasn't working, I was at the pistol range, or I was, trying to go to some tactical school or trying to do something like that. And really, it just came to kind of a moment of crisis in our marriage. And so I asked for help, and in tandem, we really tried to put things back together.
It almost seems odd from an outside perspective in that if it was an incident that occurred at work, you'd almost think that you'd want to do as much as you could to be away from work, but it seems like you did. And I don't know if that's the opposite. I don't know if is that the normal routine, to dive more into work?
Yeah, I think there's a huge spectrum of how people respond. It's very individualized. But yeah, for me, I just got sucked in.
So when you finally started getting help, are you still seeking counseling now?
Oh no, at this point, as I said, like, that EMDR treatment it's a cure for post-traumatic stress. I have no symptoms whatsoever. When I first started that treatment, if I were to talk to you and try to talk you through the incident, right, and through the shooting, I would have a breakdown, or I would be shaking a little bit, or I could feel my heart rate going up, or my blood pressure going up, and all that stuff. I could tell you the story now without even blinking. It's a pretty incredible transformation that you really go through when you do that kind of treatment.
And is it clearly obvious while you're going through it that you are making that transition?
Oh yeah, and in particular, the therapist that I saw. Most therapists that use EMDR, they do these 1-hour sessions, and you're kind of chipping away at the problem, right? That's not her method. So her method is you go, and it's like a 7 or an 8 hour or however many times it takes day where you go through the incident over and over and over again during this this type of therapy, and you literally walk in and the incident is a problem for you, and you walk out at the end of the day and you're like, that is no problem for me anymore. It's incredible.
What was the total time that it took? I call it the treatment. How long?
Sure. Yeah. So, it gets a little bit more complicated because it took several months, right?
Because I was going to say a 7 or 8 hour day, that had to be emotionally taxing.
It was one of the most exhausting experiences of my life. But no, it takes several months. So really her first phase is just kind of getting you stabilized, because you've been repressing all these emotions. You've been, or maybe you've been drinking, or maybe you've been, some kind of self-destructive behavior is fairly common. And so her first phase is really just, let's level all of that stuff out. Let's get you at least to kind of a normalized place, because that stuff's exhausting. And then we'll do this like marathon session, and that's going to be exhausting. And I remember you basically spent 2-3 days after that treatment just in bed, just totally wiped out, exhausted.